Hello and welcome back. This is part 3 of our lecture on CTG, and we will continue with the causes of baseline fetal bradycardia. It may occur because of cord compression and acute fetal hypoxia, for example, cord prolapse. Post maturity can be a reason. Okay, because of the sympathetic system, the whole heart rate may go down. Congenital heart abnormality, for example, congenital fetal heart block. Yeah, cord prolapse can cause cord compression, right? And epidural and spinal anesthesia, as we already discussed. So there is usually a rule of three. That's if someone asks you what is the rule of three related to fetal bradycardia, it's initially, whenever there is any problem with the CTG, there are some initial steps. They're called intrauterine fetal resuscitation. Okay, like we are trying to resuscitate the baby whenever there is any problem. First is turn the mother towards the left side or change the position of the mother. Okay. Second is if we check if there is oxytocin, for example, if there is an augmentation going on, stop that oxytocin, right? Stop the cause of the problem. And third is give IV fluids if there is, of course, no contraindication, right? So a bolus of IV fluids, like through a drip, and see how it responds. So in many cases, the baseline heart rate or the CTG improves. And then, of course, always consider doing a vaginal examination when if there is no contraindication. For example, if there is no major placenta previa, then of course we always do perform a vaginal examination. So, but if it does not, if it continues, so in case of I'm just talking in case of fetal bradycardia, okay? At 3 minutes, call for help. Call for help means just call everyone, right? And usually in many hospitals, there are emergency buttons, usually in the walls. It depends, vary from hospital to hospital. Just call for help. It means asking your senior to review the CTG. Yes, it can be a senior midwife if they are available, and so whosoever is around. If it continues and you have done all of those, right, at 6 minutes, just move to theta. 9 minutes, prepare for delivery, means mostly it's by cesarean section. Until and unless she is fully dilated, the head is quite low, and then we can perform a forceps delivery. But most of the cases, it will be as prepare for delivery. Cesarean section means just start to prepare, right? Move her to you have already moved her to theater, so it means just catheterize the patient and do all of the checks, rest of the things, okay? And then 12 minutes, by 15 minutes, the baby needs to be delivered, right? So by 15 minutes, the baby needs to be delivered, so that at 12 minutes, you should have started cesarean section, okay? Then the next parameter is variability. So variability, what does variability mean? Variability is a very important parameter on the cardiograph, okay? It means these oscillations, these fluctuations in the heart rate, right? So it's not, so remember that there's a main difference between ECG and CTG. In ECG, if a person is dead, it shows a straight line. In case of a stillbirth, for example, it won't be a straight line. It won't be anything. Like it will be just no trace. Okay? So if it's a straight line, that means for on a CTG, that means the baby is still alive, but variability is poor because there is no these fluctuations or oscillations. Now there are actually two ways to determine variability. Okay, like how high or low it is moving. Okay, and there is something which is called acceleration. Acceleration means a big jump. Deceleration means a big downwards. The heart rate goes down. Okay, so variability just means it is these oscillations, minor fluctuations. Okay, so there are two ways to determine it. I will tell you both. This one, it's from the NICE guidelines. Okay, so published in 2022. It says determine variability by looking at the minor oscillations in the fetal heart rate, which usually occurs at 3 to 5 cycles a minute. Measure it by estimating the difference in beats per minute between the highest heart rate and the lowest heart rate in a 1 minute segment of the trace between contractions, excluding decelerations and accelerations. Okay, so for example, if we are taking this 10 minutes window, Just select any 1 minute window, right? So this is 1 minute, and see what is the highest point. That's almost 135 right here. This one is 135, and what is the lowest one? That's maybe 115, you can say, right? So 115 to 135, that's 20. So we can say that the variability here, it's like 120. Okay, so there is the second way which I'm going to tell you, but the variation of fetal heart rate from beat to beat variability, like from one beat to the next, it occurs as a result of interaction between the mainly between the sympathetic and the parasympathetic. I'll show you how in the next slide. It's a very good indicator of how healthy a fetus is at that particular time in moment in time. Okay. So CTG mainly tells us how is the baby doing at that time. It does not guarantee that baby will be okay over the next, say for example, 12 hours or the next day. Normal variability increases an intact neurological system in the fetus, and it should lie between 5 to 25. So less than 5 is abnormal, more than 25, especially if it persists for a longer period of time, that's abnormal. Please remember that this lecture is for undergraduate level. There are few more. It's the actually CTG is a complex topic, so there are a lot more details than this. So this is meant only for undergrad students. Okay, so the other way is to calculate variability. The other way, how can we do it? So first we have to assess, of course, the heart rate, right? The baseline heart rate. And then in a 10 minutes window, now we are not looking at 1 minute window, over 10 minutes window, just select three random points, which is not a big jump or acceleration, and it should not be a big deceleration. Okay. And then see from the top to the bottom, right? For example, the difference in this case is 20. Here it is 15. Say, for example, it is 22, right? Even at least it should be at least 3 points, but they have done for 4, so that's fine. And then do 20 plus 15 plus 22 plus 18 divided by 4. So they have already calculated it will be average is 20, which falls within the normal range. Okay. So why do these oscillations happen? It goes up and then goes down. It's the see, sympathetics, what do they cause? They cause increase in heart rate. So it goes up. But what it brings it down, that's the parasympathetic system. So parasympathetic system brings the heart rate down. So when an autonomic nervous system of a fetus is normal, it's acting normally, this variability will be normal. So one of the reasons why CTG should not be performed in very preterm babies is because preterm babies do not have mature parasympathetic system. So they will have sympathetic system only, but there is no mature parasympathetic system to bring it to pull it down. As a result, variability will be like kind of a straight line in premature babies. And now it will be difficult for us to determine whether this is because of some pathology or just because the baby is preterm. So it may lead to unnecessary intervention, especially in a preterm baby. Okay, so that's why most hospitals they do not perform CTG before 28 weeks, and even in some cases, some hospitals yes they start at 26 weeks onwards, but it becomes more difficult, especially like if we perform a CTG and now I'm stuck, right? How to interpret it? So see, this is a poor variability. So So, what are the causes of reduced variability? We will discuss in the next part.